going to see.
Sorry, go ahead.
Because these vertebrae are bending and twisting, moving. If you see this little nerve, as that joint bends and twists and moves, if it's misaligned, okay, it can cause stress to that nerve. That can cause pain, discomfort, maybe numbness in the arms or legs, headaches. So when we work on giving this adjustment, and that's the correction, that's the work that chiropractors do, we'll give an adjustment and we'll get the spine to function. And then we'll teach people exercises to do to support themselves. So this is a healing art that we're looking at trying to help people get the most out of their body's function. So it's kind of like an athlete being the best they can be, just on a normal basis, everybody doing the best they can. So I'm going to bring somebody in.
Can I ask you one question as you're bringing them in? How did you know this was the career for you? Okay.
Adriana, could you come back here, please? I'm bringing my patient.
Okay, thank you.
I actually was studying to become a pharmacist. I was in undergrad school at University of Maryland, and then when I learned about chiropractic, and I just saw this natural healing art, and I was thinking about I was going to prescribe or actually fill prescriptions for my career, and I decided, hey, this is natural, it's healing. I was very athletic and into sports, and I just thought this is a really cool profession. And that's really when I got thrown on, and my studies got strong, and I just got a 4.0 from that point on.
That's so
enthusiastic
because you were passionate about
Yes.
it. That is so awesome.
Thank you, because that's it. I say if this is something that appeals to you, I mean, any of you can do this if it's your passion and you can chase this dream, but you have to really want to do it. So, hey, Adriana, come on in. Adriana's going to come in and we're going to.
Hi, Adriana. Okay.
Lay down on the table, face down, please. What we're going to watch is I'm going to do several maneuvers, and we're going to get her spine to move better.
So right now you're doing an adjustment, or
This is an adjustment. Come up on your side.
Adriana, how does that feel? Does that hurt? It doesn't hurt, does it? Okay. And so all your movements is realigning the spine.
Yes. Now you have to smile for the camera for this.
Okay.
And the power's on. And now her body's working better, moving better, and she'll get up. Can you feel the difference in terms of range of motion and flexibility?
Awesome. Like when he kind of moved your neck, it looked like it hurt a little, but no, you said it doesn't hurt at all. How often should someone, like, even if we weren't feeling any pain, this is something that we should be doing that like on a regular basis?
So I see people that come in here just for wellness, to keep their body working. Like you would go to the gym. You don't go to the gym because you're weak. You go to stay fit. So you would go to the chiropractor. You might go to the gym 3 times a week. Well, you go to the chiropractor as often as necessary. So we do a complete exam. We may take x-rays, do an evaluation, posture evaluation, then we check to see someone's alignment and motion, and we recommend what's best for them. If they're in a crisis and pain, it's going to be more than if they're doing well. Some people come because they have scoliosis or postural distortion, a lot of that forward head position. Got to work on keeping our head up over our shoulder. And again, I'll say that when you're sitting at your desk, get out of this position, acting like a praying mantis.
Like sit up.
Head up over your shoulder. A good drill is to put your thumbs back, stand up straight, and then stand in that erect posture.
Awesome. So as we get ready to wrap up, is there anything that you want students to know as they think about their career choices, especially careers in health and wellness?
I'd love to see more people choose chiropractic as a profession. If you think that natural healing is your thing, and if you think you'd like to help people and you love taking care of people, this is a great profession for you.
Awesome. Let me see if we have any questions from our students. Are there any questions for Dr. Fidel before we go to Mr. Gerard? I see a lot of you rock in the chat. Thank you, Shanae and Selena. I don't know if you have any questions that we can ask Dr. Fidel. Okay, I don't see any questions coming through in the chat. I think you did a great job explaining your work. Thank you so much. You want to say bye as well? Bye. Okay, this is Nikki signing out from Dr. Fidel's office. Take care. Have a good one. Bye. Over to you, Mr. Gerard. Yeah, I'm gonna, like, just for a few seconds. Thank you. Hi, I don't know if anyone can
There
get
we
to
go.
Mr. Gerard. Okay.
Yes, I was
Hi.
muted, but they since unmuted me. Good morning, everyone. My name
Good
is Mr. G.
morning.
I work in the CCR office, and today I'm going to flip the camera around. I am with Dr. Malik. How are you this morning?
I'm doing well, thank you.
Hold on one second, Gerard. We just need someone to spotlight you. Hold on one second.
Okay, give us one moment.
I apologize.
No, it's all right.
Let's
We want to
see.
make sure that our students see us this morning.
Yep, hold on one second, and let me see if I can spotlight you.
Yes, all right. So I should be
Okay, now
spotlighted.
you're there. Okay, thank you.
All right. So again, we are with Dr. Ariana Malik. All right. Good morning. Good morning. And we are at Catonsville Dental. So Doc, tell us a little bit about yourself and a little bit about the practice here today.
Yeah, so I'm Dr. Malik. I'm here at Catonsville Dental Care. We are on Frederick Road in Catonsville, Maryland. This practice has been here a long time, since the 1980s. And I've been here since 2021. I've been a dentist since 2014. That's when I graduated dental school. So just working out in private practice, doing a lot with patients and very well.
Okay, what made you want to be a dentist?
So it actually started when I was younger. I've always been around the dental field. My dad is actually a dentist, so always kind of had that in the background there. And then it wasn't until I was in middle school I got my braces on, and I was one of the select few people that are probably very excited about it. So I really enjoyed having that experience, and my doctor was actually a female orthodontist, so she really took me in, kind of let me shadow, let me work at the office, get my feet wet in terms of working in the dental field. And that's really kind of what's confirmed that this was the job for me. So.
Nice. All right. So when people think about teeth, I'm sure sometimes they think about the worst parts of being a dentist, possibly. But what are some of the best parts first?
So the best parts, honestly, for me, is the artistic aspect of it. We are working with people to make them more confident, rebuilding their smiles, recreating their smile, doing what we can to fix their teeth, make them whiter, make them brighter, straighten them if we wanted to. So we get to do a lot of things, and really rebuilding their smile and rebuilding their confidence is something that's really rewarding for us.
Nice. So I know someone's going to ask, and before they do in the chat, has anyone ever bitten?
Oh yeah, all the time. Not on purpose, but
right. It's a reaction. It happens.
It
right?
definitely happens.
Okay, great. So what do you have to show us today?
Oh yeah, so this is our 3D scanner actually. So I don't know if anybody remembers getting those goofy impressions. Now technology has advanced, so we can actually take a 3D scan of your teeth. And our assistants help us out with this a lot. So they'll scan the teeth, get basically a 3D model of teeth that we can work through and see. And let's say they want to actually straighten their smile, close some spaces, or realign things. We can actually do a simulation on our machine here, so they can see what their teeth could look like if they wanted to do something about it.
Great. And so are these perfect teeth here?
These are pretty perfect. I mean, these are pretty good. This is one of our assistants actually.
Uh-oh.
She has a pretty good smile, but this is actually, if I can get that back. This is what it would look like if she did it in this line. So
Oh, nice.
she has a little bit of spacing just right in the front there, so you can see those.
So it is possible to naturally have nice teeth, right? If they take care of their teeth.
For sure. And that's another thing that we really love to do, is teaching people about prevention. Because if you can avoid to have to see us, that's always, really good thing. If you only have to see us every 6 months, you're in good shape.
Okay.
And you see our hygienist and they'll clean your teeth. But yeah, we really want to teach people, how to keep and maintain their teeth nice and healthy.
Okay. So what are your top 2 tips for keeping your teeth healthy?
Well, number 1 would probably be brushing twice a day. Number 2, flossing every day. And you only have to floss once a day. But if you do that, you'll be in great shape.
All right, students. So you hear that. Make sure you brush your teeth twice a day and you floss once a day. If someone's interested in working in a dental office, but doesn't necessarily want to be the dentist because they don't want to get bit as often, right? What are some of the other professions that you have here in the office?
Yes. So another great profession in our office is a hygienist. And that's the person that you would see every 6 months. They work to clean your teeth. They keep your teeth nice and clean. The other thing they do is they educate you on how to keep your teeth clean. So that's the most important thing too, right? So if there's tools that you can use, different ways that you can use it, they really work to educate you on keeping your teeth nice and healthy. Another job that we have here is a dental assistant. So like I was saying, you know, doing this scan, this 3D scan, they help us with that. They'll take x-rays for us. They really work as our right hand, just kind of giving us the tools that we need to make sure our patient's experience is going smoothly and make sure we have everything that we need. Another job that we actually have here too is sterilization technicians, and they work to sterilize our tools, make sure our tools are nice and clean, package up nicely, get them in so that each person can come in and have a safe and healthy experience as well.
Great. And so before we get questions that students may have in the chat, what are some of the things that our young students can do to prepare to be in the dentistry field if that's what they're interested in?
Yeah, so I think number one thing is getting into a dental office, doing shadowing, getting some experience, seeing what our day-to-day really looks like, seeing if it's something that they really want to do and that they would be passionate about. I think that's the most important thing, and that was the biggest thing for me, that I was able to see it and really I could picture myself in the career. So just get in there, you know, we have students all the time that come in here and shadow, so we're happy to help in any way that we can, but that's my number one tip.
Nice. You hear that, students? So you can come right on down to Catonsville Dental and get a tour, talk to Doc, and see if dentistry may be interested, you know, the job for you. So I'm going to ask Selena. Selena, are there any questions in the chat for us today?
The chat is currently disabled, so if one of the teachers can send us the questions over, we can answer them that way. But as of right now, there are no questions in the chat.
All righty. Well, what we will do is we'll make sure we can stay connected to Doc, and hopefully we can get all your questions answered. That is all for our dentistry site visit today. All right. Thank you, Doc. We really appreciate you.
Thank you. Thanks for having us.
Thank you so much. So we're going to go over to Naisha at Reach, and let me see if I can get her on camera. Hey, Naisha.
Hello, everyone. Hello. My name is Naisha Dorsey, and I am here at Reach Partnership School today in East Baltimore. And the first class that we are joining today is our pharmacy tech class. Let me turn my camera around here so you guys can see Miss Johnson. Yes, so we have Miss Johnson here. So Miss Johnson, tell us about how you came into this role as a CTE pharmacy tech teacher.
Okay, well, that is a very long story, but the short of it, I actually thought I was getting pranked. I worked in the pharmacy, giant pharmacy, for 15 years, and I got a phone call, and they were like, "We heard you're a great pharmacy tech. We want you to come and teach." And I'm like, "Wait a minute, me?" So never thinking that my profession as a pharmacy tech would take me into a instructor role, but it did. I didn't realize it. I didn't think it was true, but it definitely was a dream come true because I found my passion and what I love to do. I love working with my students. I love showing them new things and actually giving them the experience to work with healthcare professionals hand in hand. So that's kind of how I became a CTE teacher.
Okay. So tell us, now that you transitioned from out of the giant pharmacy into the classroom, so tell us a little bit about your day-to-day role as a CTE teacher. Maybe how does that differ? Do you like it so far as opposed to being in like the actual market pharmacy?
I love it.
Okay.
I didn't know. I thought I really loved working in the pharmacy, but coming here and having these students actually intrigued in learning about the profession, it brought a whole new liking to my profession. So basically here in my class, have my pharmacy technicians. I usually get them around their 11th grade year. And we have a junior technician here, and we have our senior technician here and there. Basically what I teach them, how to count, the rules, you know, the ups and downs of what we actually do in the pharmacy. We are in the pharmacy setting with our little lab we have that mimics a retail pharmacy. And I teach my students everything from dosage calculations, they learn how to count, they learn how to compound, they learn pharmacy laws. There is a lot for our students actually to learn in the world of pharmacology,
Mhm.
but I love teaching it, and my students, as you can see, they love learning.
Yes, yes, and we're going to get to the ladies in a few seconds, but just a couple more questions. What are some key things that students can learn and earn while they're in this pathway?
So you'll learn the fundamentals of actually being a healthcare profession. Not only that, but actually being a pharmacy tech. So they basically what I teach is everything that you need to know. My students actually go on internship and work with pharmacists hand in hand. So they
Okay.
actually have a hands-on experience. Alexa here is actually working on her internship to complete her 160 hours.
Okay.
My students, again, when they leave Reach Partnership, we make sure that they are CPR, AED, and first aid certified. They also leave with an OSHA certification.
Okay.
So we want to make sure that our kids leave here and they are very marketable, where they have no worries about getting hired.
Okay, perfect. So it sounds like you said that the students have to do like 165 hours, correct?
It's 160 hours of internship. And we actually do 100 hours of instructional learning. Basically, they learn all the fundamentals of pharmacology.
Okay, perfect, perfect. And then if you had any inspiring words before we move to your marvelous pharmacy tech students, if you had any inspiring words for upcoming 7th and 8th graders that would jar their interest in this field, what would it be?
I would say definitely come along. You guys know that the world of medicine is changing every single day. There's so many things to learn. And if you like to be challenged, this is where you want to be. We learn so much about medication, the dosage forms, how medication is actually metabolized inside of the human system, learning the brands and the generics. So there's so many things that you can actually learn. So I would say to my 8th graders, my middle schoolers, if you are intrigued about how medication works in the body, this is the pathway for you. If you want to know what grandma is using or helping your family members actually take their medication, this is the profession for you. You got to have that passion to learn. Most definitely.
Okay, thank you, Ms. Johnson. So I'm going to pan over to her students here. So first, I'm going to ask our students if you would introduce yourselves and tell us what grade that you're in. So I'll start with my junior first, correct? Yes, yep. So what is your name?
My name is Tashana Ross.
Okay.
And I'm a junior at Reach Partnership.
Okay, all right.
My name is Lexa Colbert. I am a senior at Reach Partnership.
Okay, all right. So tell me your name again. Tashana. All right. So Tashana, what made you want to come into this pathway? Or what interests you about the pathway?
I noticed I'll be able to help people. My grandparents actually had a lot of illness.
Okay.
So I really wanted to know what's actually helping them and keeping them alive.
Okay. So you wanted to learn basically all about to help them in whatever medicine they may be taking. So you're aware of it as well. That is wonderful. That is wonderful. Okay. And then Alexis, what about you?
So yeah, definitely helping people. And for myself, I have mental illness. I need to take pills a lot.
Okay.
And I wanted to make sure that I knew what I was taking. Bottom line, I just like busy work.
Okay.
Yeah, and this pharmacy has all of that.
Okay. So how has this pathway impacted you personally?
I just, since I have asthma and I have to take a lot of different medications and stuff like that. Once I know what I'm taking, I feel safer.
Okay.
Going to the pharmacy and just getting your medication, not knowing exactly what's in it. It's kind of a little scary. So once I'm actually back here, I'm in a real pharmacy, I know what's going on, what I'm taking and helping people.
Okay, all right. And then also, like you said, so many of our students and some of our middle schoolers, you may have asthma as well. And you definitely want to be knowledgeable about all of the medications that either you may have to take or that your family members may have to take. And some people don't really read those pamphlets that come along with your medicine. So it's best for you to have it, for you to have the knowledge of it. So I guess for Alexis, what are some of your post-secondary plans after you leave Reach Partnership? What are you going to do?
So definitely go to college and study psychology because I want to be a mental health therapist for adolescents.
Okay. So I do see the connection where you can have that between your pharmacy tech as well as your mental psychologist. All right. And then for you, my junior, what are you looking forward to, I guess, in your senior year in the program, and how has your experience been so far?
So far, my experience has been actually really
It's been good.
Okay.
It's been
Any challenges you can tell us? Are there any challenges with the pathway?
a little bit.
Okay.
Like the words and like the abbreviations you need to know
Mhm.
in order to like put together the medication.
Okay.
It's been a little challenging, but other than that, it's been very fun and it's a lot to know.
Okay. And it sounds like you definitely need to have like those listening skills and definitely pay attention to your teacher and listen to whatever type of instruction, because we all know that if someone gets bad medicine or something that isn't assigned to them, it could be fatal, right? So we don't want to have any fatal accidents. So before we wrap up, I want you ladies to show us what you were doing here, anything that you would like to share.
So here, most of all, we count pills and fill prescriptions. So
Okay.
we have a lot of customers.
Oh, okay.
So you have to count in fives.
Okay.
So usually.
So you guys, I'm sorry, you guys actually have actual people that you fill prescriptions for?
Yeah.
Oh. Oh, perfect. Oh, okay.
Customer service.
Okay.
I have to go back in the back of the line, just like this
Right.
down here, but it's smaller.
Okay.
But I have to fill over like 100 prescriptions a day.
Wow.
It's a lot, and usually the quantities are usually 30 pills.
Okay.
50, and sometimes you get 280, and that's a lot.
Okay. Okay. So you're learning how to ration out pills and what quantity that it comes in. Okay, sure. She's gonna give us a demonstration of how she is rationing out the pills.
So these are the soft bottles where the pills come in.
Okay.
And these are where you get to the customers.
Yes.
Bag it and all that.
Okay.
So we will get 30 usually.
Mm-hmm.
Put all the pills up here, and then we count fives. Like I said, we have a lot of customers you have to get to really fast.
Okay.
It's kind of tedious.
Okay.
A little bit when you are counting.
So you have to count each one of those out individually, Alexis?
Mhm.
Okay.
But when it comes to bigger quantities like 180, we
Uh-huh.
have
Like a machine that does it? Okay, I was already asked that.
Yeah, definitely, because I would never.
Okay. And I see some questions coming in the chat. So one of the questions I saw in the chat is one student said, so how do you keep track of, or how do you know how many pills actually go in the bottle?
So we have, there's nothing on this one, but
Okay.
in the actual pharmacy, there will be the quantity, the name of the patient,
Mhm.
the pharmacy, prescriber, and all that. And it would say the quantity right there.
Okay, okay.
We have the computer system also.
Okay, so does the computer system print that out for you, Alexis? Okay, yep. And someone said, have you ever miscounted?
Yeah, you would have to double count. I've done it a lot of times.
Okay.
Basically, you have to stay focused when you're doing that because you can't give them more pills or less pills than
Okay.
what they need.
Okay.
Miss Dorsey, Miss
Yes.
Singletary's class wants to know, do you have to have strong math or science skills for this pathway?
Yes. So what do you have to have strong math or science skills for this pathway? Thank you, Selena.
Well, I'm gonna be honest with you, I'm not really fast in math.
Okay.
Not really, but when it comes to like, let's say liquids and stuff,
Okay.
the milliliters,
Yes.
you have to be a little fast with that.
Okay.
And with all the customers coming in, you would have to like count by fives really quickly.
Right.
All the medication out.
Okay. Okay.
So this is the finished product. You just put a label on there, stick it on there, and put it in one of these
Okay.
bags and give to customers.
Okay. And then one other person said, does the colors help you with like the counting? So do the colors that you guys have for like your pills here, did it help you like the colors or anything? Or you guys just have those because they're just
Yeah, these are
colorful,
just- these are just
like
the,
practice pills
yeah,
almost?
they have, it's usually white, blue.
Okay.
Certain medications have different colors, but usually it's not gonna be all this colorful.
Okay. Okay. All right. Did we have another question, Selena?
Sure. There's two more. Do you have to take any advanced subject courses? And the other one is about how many prescriptions do you fill in a day?
Oh, okay. All right. So do you have to take like any advanced or AP courses for this pathway? And that may be something that may have to.
So we do have 2 prerequisite classes. You have to take your foundations of medicine and health science. And basically that just teaches you the fundamentals of the healthcare profession. So we go into a broad range of professions, healthcare professions, dental assistants. We make sure that the students are informed about not only pharmacy tech, and CNA, what we have here, but all of the healthcare professions to make sure they have an informed decision when they're making that. And then they actually take structures and functions where they learn about the human body system. So they're able to make that connection, whether they take certified nursing assistant or pharmacy tech, it all comes in together.
Okay. And did you have another question in the chat or from someone that's
Yes, we
online?
do. After
Okay.
completing this pathway, do you get certified?
Yes. What are your certifications after completing this pathway?
I can answer that.
Okay.
So my students right now, Alexa is taking the National Healthcare Association board pharmacy certification. So that will actually certify her nationally. And then she will also take her state board test that will certify her within the state of Maryland.
Okay.
So once Alexa goes on with her other professions, or when she carries this on, she actually can move out of state and don't have to take another test.
Oh, cool. So she's not only getting that local certification here for the state of Maryland, she's getting something that will make her marketable across the United States of America with that national board.
Yes,
Okay.
and we have partners all around the city. We're partnered with CVS. Alexa is working with Giant Pharmacy.
Okay.
So we have those connections that she is able to get hired. She'll probably get hired during her internship.
Sending positive thoughts, right?
Upon completing her internship hours, she is able to actually get her license and work as a healthcare professional pharmacy technician.
Okay. All right. So are that all for the questions before we wrap up in this amazing class, Selena?
Yes, ma'am. Thank you.
All right. Yes. Okay. So, okay. They come bearing gifts.
So kids were over here, they were compounding a nice little body scrub for us. So
Oh,
we want to thank
cool.
everybody.
Thank
And this is
you.
a thank you gift from us.
Thank
From
you. I
Technician.
appreciate it. Thank you, everyone. So if you're definitely interested in the pharmacy tech field, definitely reach out or come visit Reach Partnership School in Miss Johnson. Amazing class. Thank you all.
Thank you so much, Naisha. We're now gonna go over to Barks where we have Ashley Blair of Vet Check. Hi, Ashley, how are you?
Good, how are you?
Good. Do you want to tell us a little bit about where we are right now?
We're at Barks Animal Shelter. It's Maryland's largest and only open mission animal shelter.
And who do we have with us today?
It's Sarah Jessica Barker. She came in yesterday as a stray. She's one of our new friends.
Awesome. So can you tell us a little bit about your role at Barks? Like, what does a veterinary tech do? How did you get there? What do you love about it? You want to give us a little bit of a background?
Yeah. So I have a love of animals. I worked at a hospital for 4 years. I started off as a kennel technician, then a kennel supervisor, and then a veterinary technician. I came over here because I wanted to do something a little more meaningful, helping those that were really in need. So as our veterinary technicians here, you can do a variety of things. We have surgery technicians whose job is to handle our spay and neuters and other procedures. So that can be anything from surgical prep work, monitoring them under anesthesia, monitoring them once they're in recovery, and then of course going over discharge instructions with new owners. We also have our medical department. So medical department will handle intake of all new animals. So they all get a preliminary exam, assessing their health. We'll do vaccinations, we'll do medications daily to treat any medical issues. We do digital radiography. We will also do foster appointments, making sure that the animals in foster homes are being well cared for, any medical concerns that they have. And then we will also handle intake prevention. So we offer medical care to those in need to try to prevent them from coming to the shelter.
Thank you so much. And I feel like you have the most difficult role because animals can't talk. So like,
Right.
how do you navigate communication when it's animals?
A lot of it is kind of reading their body language. So it's really hard because sometimes the dogs coming to us, they're not coming from homes, maybe under socialized. So a lot of that can be reading their body language. Some of them are really friendly, like Sarah. She's pretty eager to please. Some of them are not so friendly, really fearful. So we do the best that we can do to perform these exams while making them comfortable. So it's a lot of that reading that body language.
Do you have pets of your own?
I do. I have 2 dogs and 4 cats. So I have a pretty busy household.
Oh my goodness. I think one of the last questions before we go to see if we have any students that put any questions in the chat. Like for a young person, how would they know if this is a good career fit for them?
I think obviously you have to have a passion for animals, particularly in shelter medicine, really compassionate. We see some really tough things in private practice, but especially in shelter medicine. So just being really empowered and believing in yourself, you're going to have really hard days, but ultimately you've got to get through it to just provide the best guide.
And what subjects would they have to be, like, would they need to enter this field? And what is that, and what does that mean in high school and college? And I don't know if there's any graduate school that's required.
Yeah. So in the state of Maryland, it's one of the states where you do not have to be a registered veterinary technician to do some of the things that we do. So there are veterinary assistants, there are veterinary technicians, and then there are credentialed veterinary technicians. So to become registered, other states require that you're registered to do what we do, but to become registered, you have to take classes. I think CCBC in Essex is the only school that you can take their 2-year program to become a registered veterinary technician. Math is important, science is important. It's a lot of studying the anatomy and kind of understanding biology as well.
Awesome. I don't know, Selena, if there are any questions in the chat.
Yes, we have a few.
Awesome. Do you wanna give them to her?
Sure. How many dogs do you treat a day? About?
That's a really good question. Just doing like daily medications, it could be as many as 50 or more. Sometimes we have as many as 30 animals, new animals come in a day. So it's a pretty large number. We currently have over 100 dogs in our shelter right now.
Thank you. And what kind of other animals or small animals does Barks work with?
We get a lot. So I've seen roosters, pigs, turtles, rats and hamsters, rabbits we get a lot of. We actually had a case where we had 30 rabbits come in. So a lot of small animals as well.
There's a question about what happens if an animal isn't the friendliest or gets out of control.
We have a behavior team that works specifically with behavior and training to kind of assess where the animal is, if they're safe to care for. They will work on training things to kind of work with their issues. So if they're a resource guarder, we'll work on, kind of how best to handle that. If they're fearful, they'll work on ways to manage that. If they're reactive in the kennel, they'll do trainer feeds and just try to desensitize them to people passing by.
Can you be a vet tech without college?
You can in the state of Maryland. Some places will provide on-the-job training, which is really awesome, to give you the skills that you need to be successful, but other states require that you are a registered veterinary technician.
Have you ever gotten bitten by a dog?
I've not been bitten by a dog. I've been bitten by a couple cats, and that's no fun because cat bites are really prone to infection. So if you're ever bit by an animal, you should immediately clean the wound and then go to an urgent care to get medical treatment for that.
Thank you so much.
Thank you, Ashley. Is there any words of wisdom that you would like to leave with City School students today?
I think that veterinary technology is a great field to be in right now. There's a high demand for it. There's kind of a shortage across the nation. That if you love animals and you're passionate about what you do, it's definitely something you should consider pursuing.
We really appreciate you taking time out of your busy schedule today. We appreciate what you do to take care of our animals and saving and rescuing our animals. So thank you so much and keep up the great work.
Thanks.
Thanks. Naisha, I don't know if you're ready, but we're going to get ready to come back to you at Reach Partnership High School. Naisha, I think you're on mute. You got it.
Okay, I'm sorry. So we're actually here in Miss Harris's class, her nursing class here at Reach Partnership School. And we actually had a visitor here from our district office, Dr. Dabrowski. So she was actually able to hear our interview with our pharmacy tech. So I'm here with Miss Harris. So Miss Harris, let me turn the camera on you so they can stop seeing me. All right, Miss Harris, can you tell us what brought you into the CTE role as a teacher and what exactly do you do?
So first of all, let me just tell you a little bit about Reach first.
Okay.
Ms. Harris, Reach Partnership is a public community school where we aim to unite families, educators, and various community partners to provide top quality academics and opportunities for our students to succeed both in school as well as their personal lives.
Okay.
I believe that that's in direct alignment with the school's vision and mission, where we want to graduate every student, young men and women, to receive quality instruction and to just prepare them for an entry-level rewarding career in healthcare, such as nursing and pharmacy.
Okay. So definitely, yes, that is part of our vision, to prepare students for like post-secondary and for them to make that livable wage. All right. So what are some certifications that a student will get in this pathway? In this pathway, it's the nursing pathway, correct? Okay.
So upon successful completion, which I'll tell you the components in order for, the goal is for them to be a certified nursing assistant by the Maryland Board of Nursing.
Got it.
They have to attend school on a regular basis.
Mhm.
I know it's 5, but I tell them if I can at least get 4 days out of 5 a week,
Mhm.
I think that I can work with you.
Okay.
They have to pass a state board examination, which consists of 100 questions, which I do prepare the students for the theory as well as the clinical part.
Mhm.
We have a lab in the back of this classroom that we have twice a week. If I deem for it to be more, then we will do that, where the students will receive practical hands-on training, simulations through video.
Okay.
I have them practice with their family members at home, their neighbor. And then we have to do a 40-hour clinical at a local hospital or nursing home.
Okay.
With different partners that I have, so that because that's a part of the certification as well, 40-hour clinical experience. It's Monday through Friday, full day.
A full day.
Full day.
Okay. And what are some of the partners that you currently work with, you and your students?
Autumn Lake Healthcare, Kennedy Krieger.
Okay.
A new one I have is with Future Care.
Okay.
Healthcare on Charles Street. I have a daycare center. I can't think of the name right off. I even have some agencies, because some of the students want to do home health, and some of them may want to do private duty work.
Okay. So what are some of the careers, since these are some of our like elementary or middle schoolers that are on this call, what are maybe some of the careers in nursing that students can go into? Are there any other like careers outside of like CNA that they can be prepared for once they leave this program?
Well, as far as CTE, we offer here at Reach. We have CTE, we have for the nursing assistant.
Okay.
We have pharmacy tech, we have HVAC, we have construction.
Okay.
We have, I'm thinking JROTC, and security.
Okay. And then, but your pathway specifically prepares students to be a CNA.
My pathway does. However,
Okay.
though I prepare them to be a CNA, if you're not successful, I do provide other opportunities for
Okay.
you. I'm also in partnership with BOC, Baltimore Alliance.
Yes, that's what I wanted to hear about. Okay.
They offer apprenticeship. Also with Kennedy Krieger as a clinical aid
Okay.
students with paid training.
Okay.
They will pay them to become a clinical aid where they're working in the neuro behavior department.
Okay, so it sounds like if they can do CNA, they may be able to do the clinical aid. So there are other opportunities if they're not successful with the actual CNA program. But we know you perfectly prepared them 100% to be a CNA. Okay, all right. So we are going to speak with a couple of Miss Harris's students that are in her nursing pathway. So I'm going to ask the students if they could say their name and what grade that they're in.
Hello, my name is Cordelia Holly, and I am in the 12th grade.
Okay, you said Cordell? Cordea, okay?
Hi, my name is Mariah Riley, and I'm in the 12th grade.
Okay, come up. We have some ladies here in the back, and I'm going to show you guys the lab. So do you guys want to move back here so that way I can show them the lab while we're talking? So we're going to move and transition back here. So ladies, if you want to introduce yourself, this is almost set up like a actual like hospital kind of, right? So what is your name?
My name is Leah Hall, and I'm in the 12th
Okay, and what about you?
My name is Celine Fashaw. I'm a Minnesota.
Okay, so we have some seniors here. So I guess young ladies that are our all of you guys are seniors, correct? Okay, so I guess what interests you in this pathway? What was your interest? What made you want to come in here? Or did you just want to come and hang out with Miss Harris because she's beautiful? Like, what did it for you? Okay.
Being able to help those in need, those
Okay.
that need assistance in bathing themselves, feeding themselves, getting dressed, daily
Yes.
living that they need assistance with, helping them with that is a main priority.
Okay. And those sounds like some of the duties and responsibilities of a CNA. Okay, and what about you?
I wanted to be able to take care of others and make them happy, because when I make others happy, that makes me happy.
Absolutely.
I'm doing a good job.
Giving back. Absolutely. Okay, and then I'm gonna come to you last, okay? All right.
Okay, I love helping people that's in need, and I know, cause I would want somebody to help me if I'm in a healthcare facility and I'm
Okay.
going through the treatment, right? So I like to help people.
Okay, all righty. So Miss Harris told me she actually has a student here, and this student is one that is going through one of the apprenticeship programs. All right. So tell us a little bit about the apprenticeship that you are involved in.
Okay, so I'm in an apprenticeship called BAC.
Okay.
It's for like, it's basically for like becoming a CNA.
Okay.
But it's like an opportunity for me to do other things.
Mm-hmm. What is
I
the goal
wasn't-
of your apprenticeship with BAC?
So the goal is to become a nurse,
Okay.
but also it's like BAC like teaches me other stuff, like other like nursing stuff.
Okay.
Like stuff around that type of field.
Okay.
I wasn't able to be in the nursing program.
Okay.
Because I transferred from Dunbar.
Yes.
And I transferred like in the middle of it.
Okay.
So Miss Harris just helped me get another opportunity because
Yes.
I'm really trying to become a nurse.
Okay.
That's like one of my passions. So I just got the opportunity to be in the BAC program. I hope it goes good. And
Okay.
yeah, that's pretty much it.
Yes. So as you see students, even though you may not start off originally in a pathway, there are opportunities, and the teacher plays a big part in that with helping them to transition. So like she said, she transferred from Dunbar, but she knew she wanted to be in this nursing program. So Ms. Harris set her up with an actual apprenticeship that will give her some of those opportunities, because you start this pathway in what grade?
It starts in the 10th.
In the 10th grade, okay? And I'm going to show you guys the lab a little bit. I know we're coming down on our time. So this is the lab. And ladies, if you want to shout out some final thoughts, like what are your post-secondary plans? Because we know you guys are looking forward to this end of the school year. After spring break, it goes all downhill, right? Like it is almost go time. So what are your post-secondary plans really quickly?
I'm gonna graduate from high school. I'm gonna go to college. I'm gonna use my CNA to make money throughout college to pay for school.
All righty.
I'm gonna plan to go to college after this, but
Okay.
I'm actually in the Sinai Youth Apprenticeship Program.
Oh, woo, another apprenticeship program.
She starts April the 3rd.
Okay, wonderful, wonderful. All right, and what about you, ma'am?
I go to the fall.
Okay.
When I graduate during the summertime, I'm going to do the Kennedy Krieger program that Ms. Harris signed us.
All righty, all right.
I'm also in the apprenticeship program. I'm going to graduate high school. I'm going to go to college, and then I'm just going to pursue my dream to become a nurse.
All righty, ladies, and you definitely can do it. Keep up the great work, Miss Harris. Thank you for letting us
Miss
come
Dorsey?
in. Yes.
One question, Amani wanted to know, when do students start working with actual patients in the field?
Oh,
In the 12th grade, where we have the actual clinical internship.
okay. So in your 12th grade year, you actually start working with patients to get that hands-on experience. Any other questions, Selena, before we sign out from Reach Partnership School?
That's it. Thank you, ladies.
All right. Thank you, guys.
Thank you so much, Ms. Dorsey. I'm gonna give it back to Ms. Shanae, who's gonna close us out. Sorry that we were over time, but we had so many great partners and high school programs that wanted to kind of show you about on. But I'm gonna turn it back over to you to close us out.
Thank you. like to thank everybody who came in and participated. I hope you learned a little bit about CTE, and I hope you learned a little bit about all of our industries. We would like to thank our industry partners, our instructors, as well as our CTE and career readiness, as well as our work-based learning staff for facilitating. For teachers, please mark your calendars. We will have Career Ready Friday on April 14th, where we will concentrate on careers and transportation. We would love to see you there. For all of our high school programs, please mark your calendars, because on April 7th, YouthWorks applications will be due. That is the deadline. There are many opportunities for our students if in fact they're actually registered for YouthWorks. Even if you don't think that you're going to want to take a YouthWorks job, it's better safe than sorry. In addition, the mayor's senior hiring fair is on April 25th. You should have received information about that. If not, we can get that information right out to you, as well as our career readiness blog and our site. So please check it out. That information will be at the bottom at Anike's email. I'm pretty sure you've received several emails from her. You can look in the signature line to get those links. And with that, we thank you so much for tuning in with us, and we hope you have an amazing weekend. Thank you so much.
Thank you, everyone. Have a great weekend. If we don't see